Hello guys! If you have ever had shin splints, you know just how unpleasant they can be. That pain in the front of your leg that stops you from running, nagging away your legs. If you are dealing with injuries like a shin splint, more technically called medial tibial stress syndrome, then you are probably desperate to do whatever you can to ease the pain and get rid of shin splints, so you can go back to sports and running. For now, take those shoes off, take a break from sports training, and try not to feel bad about not doing anything more than slowly stretching your ankle and leg. We have gone through medically reviewed advice and data to deliver you a free one-stop shin splints fixing hub to give you all the wellness info you need to get back to sports. So let's get started. Firstly, know what causes shin splints. Shin splints are painful and frustrating. But did you know that the term shin splint actually covers a range of different injuries and ailments that you might encounter in your lower leg and ankle muscle groups and bones? There are several different problems that are all known as shin splints, and working out which you are suffering from will affect treatment. The two main types are bone shin splints and muscular shin pain. Bone-related shin pain is the most common lower leg problem. About 90% of shin splints are due to bone problems. In this case, the bone in your shin swells up, and this can lead to a stress fracture. This is caused by a combination of three problems. Muscular shin splints are less common, but can be equally problematic. These are usually caused by ECS or exertional compartment syndrome. Now, let's know how to get rid of shin splints. Because there are two completely different causes of shin splints, there are two completely different approaches to dealing with them, and you need to make sure you're using an appropriate method for leg wellness. 1. How to get rid of muscular shin splints. Muscular shin splints are much easier to deal with than bone problems. The first thing you need to do is to buy a foam roller, as this is a great tool that can make a huge physical difference to your muscle tightness. One of the biggest problems with muscular strain is tight fascia, the sheath in which your muscles are wrapped. This can be loosened up with some foam roller exercises. Get on the floor and run your calves and shins over a foam roll for a few minutes, at least 3 times a day. 2. How to get rid of bone shin splints. The first step of dealing with shin splints that affect your bones is a simple one: see a doctor and get a proper diagnosis. Bone stress injuries can easily become fractures, and that's a problem that will take you out of action for a much longer time. You'll also need to ensure you take dynamic rest. Go for a workout that does not put stress on your legs, such as swimming. 3. General tips. One of the best things you can do to help your body to recover from shin splints is to rest your legs. Don't put any more weight on them than you have to when standing on flat surfaces, and don't train until you're recovered. Wear loose, comfortable footwear, and don't try anything more advanced. Ice is also a great option. You should always choose ice rather than heat packs for dealing with shin splints or injured knee or toes. Gentle stretches of your shin, calf, toes, and foot can also help. Namal Hassan. Now let's know how to prevent shin splints before they happen. There are several different methods you can use to try to prevent shin splints from occurring before they start to be a problem. Let's take a look at some of the best ways to avoid leg pain. 1. The 10% rule. You might have heard of the 10% rule before, but if you're not sure what it is or how it works, then it's worth looking into more. One of the biggest causes of shin splints is increasing your training load too far too fast, putting too much unexpected strain on your legs. The 10% rule is a guideline that says that you should never increase your total weekly mileage by more than 10% at a time. That means never running more than 10% more than you did the week before, slowly increasing your distances rather than making major changes. Keeping the increase slow like this can help your legs to adjust to the strain gradually, protecting you from shin splints and other related injuries. 2. Check your calcium and vitamin level. Low levels of calcium and vitamin D can make your body much more vulnerable to injury, so you might want to supplement your intake if you're low, either with dairy products or with vitamin tablets. However, too much vitamin D or calcium can have adverse effects, so it's best to be careful. If in doubt, talk to your doctor and get some advice from them. 3. Change your SHOS. One of the best things you can do if you think you can feel the beginnings of tension in your muscles and connective tissues is to change your shoes. A good pair of shoes that offer good arch support and prevent pronation can make a huge difference and can help to keep your legs and foot safe and pain-free. 4. Shorten your stride. Long, heavy strides when you run put a lot of load and stress on your feet, shins, knee, and everything above them. Shorter, Faster strides can be much better for your body and can help to reduce the risk of injury significantly. Keep track of how fast your strides are and aim for a pace of about 80 to 90 strikes of one of your feet on the ground per minute. That's a total of 160 to 180 footsteps per minute at full speed. 5. Work on your hips and core. Your hips and core are a large part of your body mechanics, and the strength of these parts of your body has a major effect on how your feet move. Strengthening your hips and core will improve your body mechanics and strides, reducing the risk of injury and inflammation for any runner. Finally, if you're suffering from shin splints, you're not going to be running 500 miles anytime soon. You're not even going to be doing any exercise at all if you care about your health. Take some anti-inflammatory medicine, rest your legs, and try to have a bit of a break for a few days. Don't get tempted by ads for medically reviewed instant cures or miraculous pain products.